Hi everybody, welcome back to JJLM's World. I know it's been a while since I posted one of my talking videos. We're still in the middle of this pandemic, and
This is fine.
so I'm just hopping on right now to talk about some of the top reasons why I think you should join a career in healthcare administration or management. Um, but before I dive into those reasons, I'll give a little bit of background about my educational and professional background as it relates to this career. Especially with everything going on with the pandemic, our health and the healthcare system has been the forefront of our news and our everyday lives for the past almost, 2 years now. So I think, joining, most of us, when we think of healthcare, we think of, physicians and we think of nurses, but there's a whole industry and tons of roles that are around, really one of the largest industries in the United States. So I got my master's in health policy and management at UCLA. So that's really how I started into this field. And then I've worked in a couple of different organizations over the last 6 years. Currently, I'm a manager of physician network operations at a big system here in San Diego. And really, my role falls into two segments. One being I manage a Medicare program for senior population and patients. And then secondly, I recruit and onboard physicians into our health systems network to provide care for patients where they live and work. So really, we're bringing community doctors, so then our patients can access those providers where they work or where they live, so it's more convenient for our patients. So I really like the role and the career that I'm in, mainly because you really feel like you're impacting a lot of change, you're causing a lot of change within the system or within the structure. For example, the Medicare program that I manage, there's 30,000 patients under that program. So really, things that we do to streamline care, improve processes, reduce costs, increase provider engagement and patient engagement really has the impact on a lot of people. So it's not that direct patient impact that you would get from, let's say, if you were a provider or if you were a nurse, but you really do feel that you're creating a lot of change, increasing the availability and the access and the operations of healthcare for a large number of people. And really, this video is for someone who's maybe looking to switch careers, do a mid-career switch, or someone who's just starting college and they're trying to figure out what type of career do they want to land in after they finish college, or someone who's finished college and just entering the job market and trying to figure out, okay, where do I want to kind of see myself grow? What industry do I want to get into? So the number one reason why I think you should join or start a career in healthcare administration and management is because it's a career that is actually growing really fast. And there's a lot of demand for healthcare services managers, healthcare administrators at all levels of the corporate structure. So from entry level, and especially once you get into mid-range, middle managers, and also the C-suite. So according to the Bureau of Labor Statistics, this field of healthcare administration is going to grow about 30%, 32% over the next 10 years. So that's a lot of growth. It's faster than average for most industries across the United States. So there's definitely opportunities for people joining this field or doing a mid-career switch. There's a lot of demand for it. And a lot of people, think that you only work in hospitals, but there's so many other areas that you can work in. You can work in pharmaceutical companies, you can work in nursing homes, which, has a large need for healthcare service managers. You can work in a dental office, you can work in consulting firms, you can work in the government. There's a lot of government roles as it relates to policy and healthcare management and how those policies are disseminated across the United States. So there's a lot of opportunity there. So that's really one of the main reasons why I think you should join this field, is because there's a lot of growth, and there's a lot of demand for people or skilled labor within this field. Now, number two, the second reason why I think you should join this career field is because the pay for this career field is pretty competitive and it has pretty good benefit structures. So most hospital systems, the average pay for, let's say, someone who's been in this field for about 5 to 10 years, the average pay across the United States is about over $100,000 for a health services manager or a healthcare administrator. So they get paid pretty well and pretty high above the median household income for the United States. So it's not going to be a field that where you're making millions of dollars, of course, but it can afford you a pretty comfortable middle class lifestyle. And also on the benefit side, usually you have your standard benefit package within this type of role. Some healthcare systems throughout the United States, they still offer pretty competitive pension plans. So that's also a great thing to know for your retirement strategy. So overall, the pay for this field is pretty good. And as you move up throughout the corporate structure, you can make even more. So it's not unheard of that you have some executive level, or also it wouldn't be middle management, but it would be the step before the C-suite. So it would be like your directors or your senior directors. They can make well over $250,000, $200,000 to $250,000 a year. So it is a field that you can make a good living off of. So the third reason I think you should join the career in healthcare administration is because there's going to be a lot of growth opportunities even within one organization or single organizations. The first reason really talks about the growth opportunities across the whole industry. Is going to be a lot of demand. But within one organization, like a healthcare system, for example, as time goes by, there's going to be tons of changes within healthcare. Healthcare is extremely complex and there's so many levels to it. But I think in the next 10 years, like I see in reason number one, because of the large demand there's going to be a lot of different opportunities that will come up as healthcare begins to innovate. I'll give you an example within my role. So I work with a lot of Medicare insurance, with Medicare and Medicare Advantage insurance plans, and the senior population. Now, that's a rapidly changing population, and that will need different types of care, infrastructure to be built and to be tailored to their needs. And we're going to have a larger influx of Medicare eligible or people who are 65 and older entering into that period in their lives where they need more access and higher levels of care. So, but at the same time, we're going to have to offer it in a very streamlined, operationally efficient and cost-efficient manner. So that means that there's going to be a higher need for health services managers who are skilled to ensure that operation efficiency, cost efficiency, and high levels of care delivery and high quality is being offered to these patients. So who knows what type of even expanded roles will occur because of this large influx of baby boomers that will now be accessing Medicare. And obviously the cost is going to be a large component of that. So we're going to need more skilled individuals and managers to ensure that those costs are being contained, and that for future generations like myself and people younger than me, that we can still access Medicare once we get to that age. So the fourth reason why I think you should join the field in healthcare administration is because the barrier to entry from an educational standpoint is not that high. You just need a bachelor's degree to start working within this field. I started working in this field at a master's degree level, but I have a lot of friends and colleagues who only have their bachelor's degree or started the field with their bachelor's degree, and over time, they probably get a master's degree. Now, with a master's degree, you can access higher paying roles and higher levels within the healthcare industry structure or the corporate structure of healthcare. But you can start off with a bachelor's degree. So most of the time, if you get a bachelor's degree, you don't have to get a bachelor's degree in healthcare administration, but you can get a bachelor's degree in marketing, business, psychology. You can get a bachelor's degree in accounting. really, there's not a specific bachelor's degree that you need to get. Obviously, you'd want to get a bachelor's degree that's more geared towards business, because healthcare administration and really the healthcare industry is essentially a business. So if you were to get a bachelor's degree more geared towards a business function, marketing, psychology, business administration, accounting, finance, you could easily use that bachelor's degree background and shift into a healthcare administration role. You could start out as a project manager, project coordinator. You could be an analyst for an insurance company. You could be, especially if you're in accounting or finance, you can enter healthcare through that realm, because there's a ton of accounting, a ton of finance. If anybody who has got a medical bill in the mail and read that, that's all built by finance managers, accounting managers, and all the analysts that fall under those people. So there's tons of roles in that component. Or if you got a bachelor's degree in business administration, you can easily transfer that into a healthcare services manager role. So really, it's a bachelor's degree is where you need to start. Now, if you want to start out at a higher level, you can go the master's degree level. Obviously, that comes with more debt. But and I'll post another video regarding how to choose a good healthcare administration program, because you can find a program that allows you to get a higher paying job and then not have a high debt to income ratio. So we'll talk more about that in a separate video. But yeah, fourth reason is that the educational barrier to entry is pretty low. You just need a bachelor's degree. And once you have that, you can really start the process of getting into this career and then build your education over time or build your experience. Sometimes you don't need more degrees. Having a bachelor's degree with a lot of experience can set you up for success, even at the C-suite level. So number 5, the fifth reason why I think that you should join healthcare administration is because the work environment in healthcare administration, I think it's a great work environment. One, because you get, it's a really standard work environment. It's a standard office environment. It's less dangerous than some other types of industries. It's pretty safe because, like I mentioned, you're just in an office environment. You have more or less regular hours. Most healthcare administrators, unless they're on call, which is more for the hospital or emergency department administrators. But if you work in the standard business unit, which most administrators work in, it's your normal 9 to 5 business hours, Monday to Friday. So you're not at the risk of having very long hours. But sometimes you do have to work longer if there's big projects or big implementations that are happening. That definitely happens in all healthcare systems and organizations. But for the most part, it's pretty standard 9 to 5, Monday to Friday job with your standard vacation allotment for the year. That's number 1. It's pretty standard work environment, safe work environment. Number 2 is that it's a very diverse work environment. So you get to work, especially if you work in a larger healthcare system, you get to work with many different types of professionals. So in my role, I work with doctors, I work with nurses, I work with lawyers, I work with accountants, finance managers, I work with government officials. So you get to learn really a lot within your work environment, different types of terminology, different types of jargon from the different realms within healthcare. So it's not only healthcare focused your terminology or jargon, you're learning finance terminology, you're learning law terminology, government terminology, policy terminology. And then you get to understand how all those different types of professions work together to produce a more efficient healthcare system. So that's one of the reasons why I think it's a great career, is because you get such a diverse group of people working together and you get to learn from one another. Just to recap, the 5 reasons why I think you should join a career in healthcare administration is 1, overall the industry has large demand for it over the next 10 years. Number 2 is that it's pretty competitive in terms of salary and benefits for the amount of education that you need to put in. Number three is that within organization there can be tons of growth opportunities because of the changing nature of healthcare on a really a yearly basis, as we can see with this pandemic. Number four is the fact that the barrier to entry for healthcare administration is only at a bachelor's degree, so you can really get your career started, right out of college at an analyst or a project manager or a project assistant level. And number five is the fact that your work environment can be very diverse in terms of your working professionals and the different types of professional backgrounds that they come from, all working together. And you have a safe, standard working environment that's not overly laborious or tons of hours compared to other industries. Yeah, so those are my 5 reasons why I think you should join a career in healthcare administration. As technology develops and as things change over the next 10 years or so, who knows what type of roles we'll have moving forward. But this is a field and career that's definitely going to grow, because as we innovate, we're going to need new types of people to manage those operations, to manage those maybe machines, personnel, and how those things work together. So I'm going to post more videos. I'll create a series. So I'll do one about choosing different professional programs or educational programs to get into this field, how to interview for these types of roles, how to advance your career. So I'll definitely create a series for this. But drop a comment below, let me know what you want to see, or if you have any questions for me or about the industry. So again, thanks for checking out this video at JJLM's World, and remember to never